And who else is a better person than all of you and all of us, you know? I'm going to share the screen now. 1 second. Are you able to see the screen? Are you able to see the screen?
Yes, ma'am.
Okay.
Ma'am.
All right. Well, when Ganesh ji gave me the topic marriage and mental health, and I'm just thinking, oh my God, what a heavy topic that he has given to me. And then I'm thinking maybe at my age and the experience I have, he concluded that I may be able to contribute something to better understand this concept. So I'm going to do my best. And in this journey of 1 hour, I would want you to travel along with me and please ask questions, clarify doubts, and I like interactions because it is slightly different being online rather than in person. So there is this reaction button there. Anything that I like, I say that you like, you may give your reaction button, applaud, raise your hand, you know, whatever you want to, just keeping the interaction alive and active. So when the topic marriage and mental health was given to me, I've been deliberating on it quite some time. And only yesterday I came up with a substitute topic because marriage in the last, I would say, more than a decade, is becoming a forbidden word. It is almost like, you know, the millennium kids, I would say kids because I'm old, they are very allergic to the word marriage. So what I did was, let's think about how we treat ourselves, which is the intrapersonal, how we value ourselves, how we take care of ourselves, and then how well we have interpersonal relationships. It could be your boyfriend, girlfriend, it could be your live-in, it could be your children, it could be your family members, it could be your caregivers, you know, it could be anybody. So I thought I would give this generic title of intra and interpersonal relationships and mental health. If you like the topic, please put your hands up or thumbs up. Thank you. Now I'm going to proceed further. Thank you. Now, embrace your mind and be kind. The reason I'm saying that is normalcy or abnormalcy is a state of mind. And we all know that human psyche is unique in nature. But sometimes we find we go to one doctor and the doctor's treatment seems to work for us. And then we conclude that that is the best doctor that we have found. And we share it among our friends, families, and they all flock over there. However, what worked for us may not work for them. So first we need to understand human psyche is unique in nature and each one responds differently to the treatment, to the illness. And so first let's come to terms that human psyche is unique in nature and there may be some common elements, but most of the time it is going to be distinctively different for everyone. Now, this debate has been going on from time immemorial, whether it is hereditary or environment that plays a role in the development of personality. But when we think about it, in some cases of generalized anxiety disorder or panic phobias, there seems to be some genetic coding, some DNA present. So it does have a role in play a role in the family hierarchies, you know, the descendants. However, environment also plays an equally important role. When I say environment, I'm talking about the childhood trauma, neglect, or any type of abuse. They also play a role in an individual's personality, in the psyche, which can impact the chemical reactions of the mind. Do you know that our body has almost 80% of juice, some form of liquid or the other? So the chemicals that play a role, like serotonin, dopamine, oxytocin, all those adrenaline, endorphins, it does have the connection between mind and body, genes and the environment. So when you look at it holistically, there is a mind and body connection. Now I'm moving into the simple mental illness. Can I do a confession now? I have simple mental illness. What does it mean? I do get anxious. I am fearful. I do get angry. I do get sad. I do imagine things. However, they are all within the purview of my control, where I am able to handle the everyday activities of life, and that does not disturb me. So it is within the control. When we talk about chronic mental illness, we are talking about loss of touch with reality, poor hygiene, agitated behavior, or complete isolation and withdrawals. So I'm not going to go into the details of the psychopathology, but I want us all to understand, as human beings, we are all going to experience some element of all these cognitive modules and the emotional modules. However, how well we keep them intact is where we get in charge of our lives.
Uh-huh.
Now, let me go into the concept of marriage in India. Definitely, marriage universally entails commitment and lifelong responsibilities. But you know what? In India, marriage is not just between two individuals, it is between two families. However, current generation, it is looked at between two individuals. So from being a collectivistic society, we are also becoming the individualistic, like the Western concept. However, in our culture, it is the amalgamation of both families where they emphasize on being seen, heard, and listened to. And that's where the problem happens, because sometimes unsolicited advice,
psychologist Chennai.
boundaries being violated, not knowing the limits and limitations, advice, advice, advice until smoke comes out
Worth
of your
consultation
ears.
generally, psychology.
So, in some, marriage is
One right
considered
to
as
Prakrit Gaunate.
achievement, and there is also this myth: get him or get her married, and then she'll be okay. You know, let him get a child, he will be more responsible, or she will get more responsible, and they all are excuses to further debilitate the condition, because scientific studies have not produced results, evidence based information that getting married makes one person responsible. There are no scientific evidences. It is our hope. And sometimes that backfires. And most of the time, they say it takes a village. Our family and friends become our unappointed lawyers, referees, whom we call in when we have issues. Sometimes they are taken to faith healers, astrologers, soothsayers for anything and everything, whether it is family relationships, childlessness, marital conflict, or mental illness. Now, to tell or not tell, if if I am going through psychiatric treatment and I need to apply for a job, should I tell my employer? I want audience participation here, please.
Hello, ma'am.
Yeah.
Actually, I'm currently not experiencing any symptoms. So, while applying for the job, I had not mentioned anything to them, like I have schizophrenia or I have a mental illness or something like that. So, I didn't mention anything to them basically.
And you're comfortable with that because you're in remission, you're in charge of your emotions, and you feel that you can handle the work stressors. Am I
Yes,
correct?
yes,
Okay. Now, as long as you feel, you believe that there's no need for your employers to know because it can be counterproductive. It can
exactly,
backfire on you.
exactly.
At the same time, I also find some employees giving that as an excuse for their delayed, their late coming, absenteeism,
Mm-hmm.
or
Mm-hmm.
even not completing the projects, giving the treatment as an excuse. And that can really damage one's position at workplace. Now,
Agreed.
as I said, ma'am, you mentioned about you're in remission and you have no zero psychopathology, and you're in touch with the day-to-day activities. And are you under consultation with the doctor to ensure that you are going to continue being this way?
I am like in consultation with my doctor on a regular basis, and I'm taking my medication on a regular basis also. So that,
Wonderful. Give her a big round of applause. That is very, very important because, see, the thing is, it is like diabetes or cholesterol. We do take medicines regularly, and sometimes you are able to come out of the medications with your lifestyle modification.
Mhm.
But when you're talking about cardio issues or lung issues or any other health reasons, you are able to take the medicine and manage that. Now, when we can do that for our physical illness, what is wrong in doing it, continuing it for the psychological illness? And why do we have to be secretive about it? When I say secretive about it, I'm not telling that you should be telling the employers, but I'm just saying, why should we feel shy or embarrassed or uncomfortable to talk about it?
Sometimes, it there has a it has come up that when talking to my not my manager exactly or anyone in my job, but to people also that I take antidepressants or so and so pills, but I'm not shameful about it. Although I know that I have to take these for a lifetime, sometimes it disturbs me that why do I have to take these for a lifetime? I'm a bit upset about that also sometimes.
Yeah, see, the good thing you're doing is consulting your doctor on a regular basis because they also understand the stress that you people go through, and they give you vacation time off from the medication every now and then. Because I want to share this client of mine who was a chronic OCD who went on medication, and the therapy was, parallelly going along for her, and OCD came under control and the therapy continued. Almost 3 years we were in meeting and going through the cognitive restructuring, emotional regulation, behavioral modification, whatever we can do to help her be in charge of her own conducts. When I say conduct, I mean her day-to-day activities. Now she has reached a stage where any obsessions that crop up in her head immediately she gets in touch with me or the doctor, although she is on regular medication in very mild dosage. Sometimes I find her doctor saying, just take off for a week or so. But if you're going to feel uncomfortable, if you're getting restless, contact me. So you can be, it's almost like finding a psychiatrist is almost like finding a partner, life partner. Because when I moved back to India and started my practice, I visited almost 10 to 12 psychiatrists in Chennai, and of course they didn't welcome me, they didn't treat me right, and they also felt that I am a competitor or I will be stealing away their patients. It is unfortunate, but I did not give up. I would still go talk about my boundaries, my professional conduct, my ethics. And can you believe I ended up only with 2 or 3 psychiatrists finally where I could refer my clients who may need medical intervention? Because there is also the stigma or the myth that once you are on medication, you will become a zombie. You'll be sleeping all the time. And that does happen for somebody who are on antipsychotic with high dosage, who have been totally out of touch with reality. Probably, yeah. But that doesn't come for everybody. So what happens is people conclude that medications will make them zombie. That's not true though. When the doctors prescribe medications, they have to look at your gender, BMI, your other medical conditions, family history, and then they prescribe. After prescribing, they also monitor you, especially if it is antipsychotics. They have to have you lithium, they have to make you take a blood test to ensure that everything is within the referential range. So there is so much of care being given by the psychiatrist, and if they recommend, if the clients feel about the psychotherapy, therapists are available. So there is a lot of support system given to them. So be mindful when you're selecting the psychiatrist or your doctor. Make sure that they are meeting the criteria. They cannot be prescribing the standard medicine for everybody. For some people this may suit the chemical components, for some it may not suit. Sometimes it's a trial and error. But if you trust the doctor and you continue meeting with them, definitely it'll help. But I can hear the frustration because I take diabetic medicine and I don't like it, but I have to, and I'm seeing how I can get out of it. So I'm pumping up my exercise and my diet to ensure that I come out of the medicine. So I see where you're coming from. Any other questions?
Actually, ma'am, there are many people who tell me that please discontinue your medication. There's nothing wrong with you. You should stop your medication. But that doesn't deter me from taking my medication. I at least monthly visit the doctor and then take my medication.
You're on the right track, lady, because they are not doctors to tell you that you need to stop. So
Right,
this
right.
is another thing. I told you, in my previous thing, too many people being unappointed referees and advisors.
Yes, yes,
So we need to filter them out.
yes.
So to tell or not tell. Now, with regards to the work situation, it has worked for you and you are ensuring to maintain your sanity and being truthful to yourself and to the job that you're doing. What about when it comes to relationships? Let's say somebody is getting into a marriage proposal. What happens?
May I speak again?
Can we give chance to others, please, if
Yeah,
you don't
sure,
mind?
sure, sure,
Okay.
sure.
The rest of them are sleeping. Ganesh ji, wake them up.
Well, we have a question. We have a couple of things in the chat box.
Okay.
For example, it is important to disclose are we talking about employers or prospective matrimony, or there are my question has always been that how to behave in these circumstances if I hit a crisis, if I have an episode at work. That's how does one behave when one is at work?
Definitely,
Okay. The question is
one second, Ganesh ji. You
Yes.
said first the target per people that I was referring was an employer, but now I'm moving into the matrimonial part of it. But your question about this episode happening at workplace, how do you handle? I will come back to that, but you had something else now to say.
I mean, since there's a bit of a lag, if I can be heard.
Audio is bad. I think you probably have to do it in a relationship, mandatory to inform the spouse.
Can I be heard? Hello?
Now, yes.
Can you be a little louder? Is it Rohan?
Yes. So if you can hear me, I can give an example of this in my own family.
Okay.
I have a cousin who suffers from schizophrenia, and many years
Is he
ago.
under remission? Is he in remission?
Yes.
Or
So
still
this
suffering?
was the example that I'm giving you is about maybe 20 years ago.
Okay.
We come, his side of the family, my side of the family, my immediate family is very progressive, but his parents and such, not necessarily so. And they kind of went ahead and found, they went in for an arranged marriage without informing the family or the bride about his condition. And poor girl, the poor lady was completely shocked and horrified because at that time he was not in remission. He was still going through a lot of challenges and struggles. And it turned out to be a horrible situation for him, the patient, as well as his spouse, because she had no idea how to deal with it. This was still the 90s or still the 90s. So there was still a lot of way more stigma than there is now.
What is your question, Rohan?
No, it was just a comment, which is I feel that it is very important to disclose in cases of romance and matrimony, especially if it's arranged marriages, where
whether it is marriage or in a relationship or if you're dating or if you're going to do a live-in, it is important that we share that information, and it needs to come from us because trust is an important factor in a relationship. When the trust is violated, that's what happened with your cousin. It's a betrayal of trust. They did not share that information, and absolutely the trust has been lost, and so there won't be love. So there is no love and no trust. How will the marriage survive?
I want to say that mine was a choice marriage. I lived with depression, and my partner knew about it and got married to me. And we decided, and he in particular decided, and mine was an interreligious marriage. So he in particular decided this was not the time to tell his parents, that it was enough that he knew, and if necessary, he would tell his parents at some other point. So that is what happened and transpired.
Ranjini, I think I admire you and your husband to have made some conscious choices to keep something private within yourself. And I think you have the right and the power to do that as long as you have your spousal support. And definitely, I'm sure he's also watching out for you, like how Ganesh ji was saying. If there is an episodic attack that happens in your in-laws' home, especially when they are not aware of it, is he going to just dive in and give you that safe environment where you are able to go through whatever you go through, but still not get pulled up for misbehavior or abnormal behavior? Isn't that important?
Yes, it is important, but being nuclear, it didn't matter so much.
That's what is happening now. The nuclear families really have distanced family members. it has its own boon and bane, I would say. And I'm not here to support one or the others. Sometimes it's good, sometimes it can be, a pain in where. Now, I want to address Ganesh ji's query. Let us say that episode happens at workplace. How do you handle? Now, what would be the condition? What is the simulation that we could take, Ganeshji? Should it be an OCD case or a bipolar? What is it you want to take here?
Generally, we can say that someone's mood is switched to a depressive, like a cloud over him, hanging over him suddenly, for no reason at all.
Okay.
All
right. So when that happens and that individual is aware of it, no harm in going to the the restroom, and or if they have a medical room, what do you call that? I don't want to use the word restroom. Restroom means bathroom. What do you call that? Doctor's place or nurse's station, whatever you call it, the workplace.
Yes.
If you can take a break, inform your colleagues or somebody saying that I don't feel well, I want to take some rest and then come back, you can. But if one is aware of it.
In my case, the doctor had also prescribed a particular SOS medication to be used if in extreme stress. So I also found it useful to do something physical, like run, exercise, listen to music, whatever, to pull out of the negativity which I felt. I don't know if this is helpful to anyone else.
You have brought out a very good point, Ganeshji. SOS pill is something that doctors give in case of emergency to put it under the tongue, and definitely it comes in handy. But I don't know if the body is so worn out and exhausted, especially when we are talking about, depressive episodes. You don't have the energy to run or do some physical activity. At that time, it is better to just curl up and give yourself some time to recoup with, of course, the SOS pill.
I also had a quick question.
Yes, sir.
I understand it is important to disclose, to gain trust, to care for the sake of trust. But many people are ignorant of the condition, the illness itself. Many people are ignorant of the illness. And sometimes would it not help to develop a degree of comfort with each other in any relationship, whether it be marriage, a friendship, or a significant other, or whatever you choose to call it? Perhaps this will be covered under when to tell. That is, basically, we have why, who, what, where, and how. When to tell and how could probably be in the presence of a professional or a family. So could you elaborate on this? Why, who, what, when, where, and how?
Absolutely. 5 W's and 1 H is the mantra of life anywhere you go. And in this situation, who do we tell? What do we tell? Why should we tell? And when do you tell that? And where? That is, which place, in which context you talk about it, and how do you say it? And it's very important. Now, let us say at workplace, this first, the participant who was sharing with us that she shared at work, not that she was going and trumpeting to the office people that, hey, I am on antidepressant. No, when a situation came and they were talking something about depression or something about somebody not doing well, yeah, it's about not feeling well, you go to the doctor and take medicine. So it is a casual conversation that can be made. When you're talking about you're dating somebody and they like you and you like them, and it's going to the second date and third date, if it's getting serious, it is better to say that I have been diagnosed with this and this, but now I am in remission, I am on medicines, and I am in control. And They will be freaking out. They may freak out, or if, like Ranjita, if if you have a partner, they may understand, or they may even ask, "What is it that you suffer? What is the frequency of it?" And what happens when you go through that, so one needs to have the patience to explain about that. That is how destigmatization is done, by the client themselves to the partner, by the therapist to the family, because family is also not aware of it. I had a case where BP, bipolar boy under remission. His was arranged marriage, and the family, the boy's side, did speak with the girl's family, and the girl wanted to meet with the psychiatrist and me, because I was in doing the therapy for that boy. And she said she wanted to know about the the illness, and then its long term consequences, short term consequences. What does she have to watch out for? And one thing I realized was, it's not just preparing the girl for this marriage, I also have to prepare the boy for this marriage, because for him, he was considered as the sick one who needed attention in the family and over pampered, where everything was handed to him before he could even ask for anything. So he was treated royally in his house, and if he's going to expect that from his partner, life is going to be hell for her, because that's not what she's wanting to. So I realized that I had to work with him also in this relationship building. So in this case, in her case, it was, I had to tell what I have to tell, how do I tell, and why I should tell, because it's her future. And the family reached out to me and to the psychiatrist. Psychiatrist said, he can lead a married life. And coming to think of it, a lot of people these days are under psychiatric medication, and they are in entertainment industry, politics, running big companies. Due to some chemical imbalance, they are compelled to be on medication, but they are able to handle the daily activities of life, which also includes marriage and relationships. But I will come later in my next slide about the issues that may crop up. Any other questions before I proceed to the next slide, please?
Ma'am, I have a question, ma'am.
Yeah.
One of my client, accompanied by her mother, she brought the medical records for my observation, and it was written, it was paranoid schizophrenia. So the daughter was telling fancy stories to her mother and avoiding going to her husband's place. So then mother asked me whether we could reveal that she is having this disease, because already she is disturbed and agitated, not going to his husband's place. How we can, whether to reveal it or not to the daughter, she wanted to know. Daughter is aged 38 years.
To reveal to the daughter that she has paranoid schizophrenia? I'm a little confused, yes. Fatima, here.
Yes, ma'am. The daughter, she doesn't know to read English, and the diagnosis written was paranoid schizophrenia.
Okay.
But she believes that whatever she thinks, she believes whatever her beliefs are true. But that is not actually true, because it is due to her disease. Whether this can be conveyed to her daughter and explained or not, that is the question given.
Definitely it needs to be, but as long as she is in touch with reality, she is able to say the date, days, time, personal hygiene is good, and then probably consistent medical intervention along with the therapy. In therapy, she can be educated about her illness, but there is a time and a place for that. Looks like she's not ready now. That's what it sounds like to me.
Yes, ma'am. She believes whatever she thinks is correct.
So she's not ready there. See, another thing that I have noticed is whether it is schizophrenia or bipolar, if there are personality traits combined, it can be very stressful both for the clients and the caregivers and the rest of the family members, and at workplace also. Because the personality is, if it is like a narcissistic personality or paranoid personality or, completely dependent personality, it can be very stressful, in spite of the medicine. So it can get hard. Bottom line, to tell or not tell at workplace, under remission, when we are in charge of our own health, there's no need to talk about it. And if any discomfort happens, to take some time off, to be isolated, or do like what Ganesh ji says, go for a run or go to the gym and do some workout, pump up some endorphins. Okay. In relationships, it is very important whether you want, it comes from you. And in the arranged marriages, it is better the parents talk with the other family members, with the boys or the girls side, the opposite side, and explain to them what has happened. And if it happens, see, one of the fears that people have is, once that news goes out, then he will never get married or she will never get married. So, in order for this person to get married, are we going to put somebody's life in bay? And that is a big question that we all need to have with our fellow humans. Now, what causes what? Can mental illness cause distress in marriage? I bet. Yes. It can cause. I will go in my next slide on that. Can marriage cause distress and mental illness? Marriage can cause distress. If I give you my husband's number, he will vouch for it. No, I'm just joking. Yes, it can cause. Marriage is about responsibilities. It is about ownership. It is about the different roles that we take in our life. Being a son, daughter, daughter-in-law, brother, sister, mother, father, employer, employee. So that can add to anxiety, depression, or any other illness. Now, before getting into a relationship, is it better to talk about it? Absolutely yes. Now, during the relationship, if such attacks come, be mindful about it, inform the partner, and tell them that you need some time away, time off, and cool off period. And please understand, if they want to stay in the relationship, they will. If they feel that I cannot handle this up and down roller coaster rides, they're going to walk away from the relationship. So be prepared for that. And if you choose to part ways, it is better that way rather than living in distress and unhappy. Impact of mental health issues in marriage, family, and live-in relationships. I think we are running real short of time. I have 15 minutes. See, the mental illness can have disruption in behavior, and it may result in inability to function satisfactorily and meet the obligations of marriage. What are the obligations of marriage? Hello? No one wants to speak. Obligations of marriage are
love, respect, and trust.
Love, respect, trust, sharing, and caring.
Correct.
But when somebody has mental health issues, are they in a position to care for their partner?
Yes.
Not all the time. If they are getting the attacks, they may not be in a position to care for their partner. So the obligations of marriage, if that individual will not be able to fulfill, they need to look at their decision. And non-disclosure of past or present mental health conditions at the time of marriage, it not only, it can adversely impact the possibility of marriage in the future. Even if they get married after disclosure, there will be several factors to be equated. In this case that I was telling you about, this bipolar, what happened is the medication that he was on, it has its own side effects. You all know that. And his libido was so high. And for her to be in full-time employment, taking care of the household, and having a daughter to care for, she really struggled to keep up with her husband. And he was not understanding that. For him, that was rejection. You don't love me anymore, you know. So when they came in for the session, I had to look into the medical intervention and speak with the psychiatrist to see if there are any side effects caused by the medicines that he's taking in, you know. So these things also, you know, they can be asexual, they can be low sex drive, or they can be high in their libido, and that can distress the partner. So these are the things that need to be worked out not by themselves but by under the professional care. Okay. As I said earlier, some people with mental health issues combined with personality issues may have or will have low self-esteem, and they feel inadequate. And that is where the paranoid comes in. Who are you talking to? You know, right now I'm offering, you know, a free counseling service to a man who is on wheelchair now, and he wants his wife by his side all the time. Anytime she goes steps out to take a phone call or go buy medicines, he wants to know where you're going, who you're speaking with, when will you come back, why do you look so cheerful to go out. You know, there's so much stress on her to be dealing with his paranoia. So such things can really break the marriage. And when the needs are unmet for either of the parties, definitely it is going to disrupt the bond. And sometimes when the caregiver or your partner tells the person who is on medication to be calm, please don't get agitated, they get angry about it. And what they don't understand is they are showing their concern so that one does not get agitated and go out of control. That is misinterpreted as interference or micromanaging. And this is also something that the caregivers need to be mindful of. What is misperception? Two things that ruin an individual. It can make or break relationships. One is imagination and the other one is perception. Perception is your interpretation of what you see, hear, and you form an opinion. It may not be correct. Like how that wheelchair husband is misperceiving that his wife has a brighter face when she comes back from a pharmacy or comes back into the room as if she has had a good time outside. That's his misperception. So it is very important for the therapist to work with them on the misperceptions. Again, I'm telling you, with people who are on antipsychotics, it is the family who needs the therapy. The caregivers need help on how to handle the client more than the patient. One time, this person was sent to me, extreme depression, and doctor said we cannot put her on medication anymore because her platelet was low. When she was brought to me for therapy, and what doctors do is this personality issues or combined with some illness, you know, or when the platelet count goes low, they send them for therapy. But when there is chemical imbalance, no therapy can help an individual to take charge of their life. So I had the difficult time. I'm just looking at her. She's sitting there, flat affect, unable to even respond to me coherently. And I said, this is not going to work. She cannot be on medication because her platelet is low, and no therapy or counseling is going to help. And I was thinking, what can I do? I realized at that time that maybe sending her for yoga classes would help. The reason I'm saying that is whether it is anxiety, fear, panic, anger, whatever it is the oxygen that goes into the head. So I felt that maybe sending her for breath control, ability to inhale, take the oxygen and release the carbon dioxide in a meticulous and methodical manner would align her cognition part. She went there for 6 months, after which I was able to sit in with her for therapy, to be able to work with her trauma with her in-laws that she went through, and that was what had taken her to the extreme depression stage. So even offering therapy to the clients, it's going to be very difficult. That's why I prefer working with the family first to get them all in alignment with the therapeutic alliance. Then I'll be able to work with the clients. So this is not just for the people who are on medication or who are in remission. This is even for the caregivers or the family members. Self-care is very important. You'll see all the time, we see in the aeroplane, first thing, in case of emergency, put the oxygen mask for yourself and then you help others. The same case, only when your daily activities of life is normal, ability to sleep on time, eat nutritious food, you'll be able to care for your family members, or you can care for yourself and others. When I say don't be an enabler or manipulator, what I mean is, enabler is when somebody is unwell, we sometimes overdo things to the point that they think it is their life's privilege and duty of others to take care of them. And that expectation kind of, trickles down to the person that they are in relationship or they get married into. That is, so don't be an enabler for the family members, for the caregivers. Don't be a manipulator, I'm saying, for the clients themselves, because they feel that they have the right to demand attention, they have the right to be paid attention to. In that process, they manipulate, and they sometimes, their self-defeating behaviors create more distance than becoming close. Don't hesitate to seek support. And as the first participant said, don't listen to outside people. They are not doctors, they are not trained professionals. Seek professional support, okay? Psychological help. Psychological fitness is what I'm talking about. What is physical fitness and what is psychological fitness? What is psychological fitness? Psychological fitness, you have 3 tools in your system. What are those? Your head, which is cognition, your heart, which is your emotion, and your behavior. And these tools, if they are managed properly, you will be able to depersonalize when somebody criticizes you or finds fault with you. You'll be able to compartmentalize your role, my role as an employee, my role as a daughter, as a daughter-in-law, as a wife. You'll be able to compartmentalize and not just make a tossed salad out of it. And what is psychological hygiene? I'm sure you all took bath today. Did you? Psychological hygiene is mental overload. Keeping everything in our head. What happens in the computer when the information is overloaded? What happens to the computer? Hard drive crashes? The same thing with us. Psychological hygiene is control or delete any unpleasant, negative experiences, take the learning out of it and delete the rest. Purge them out. Don't hold on to it dearly. And that is what is going to help us be psychologically fit. Thank you so much. And I'm going to open the floor for Q&A now, and I'm going to stop share. Ganeshji, did I take too much time?
No, ma'am. We're good on time. We can still take a couple of questions. 5 or 10. Five questions.
Sure.
If you could, yes, please. Please raise your hand and when you want to speak, and then get on.
If you want to speak, you can just speak. Sagar, do you want to ask the question? Sagar, are you asking question?
Sagarji.
Sagarji, are you asking question? Because we can hear some voice, but we cannot understand what you are saying.
Hello.
Yes.
Yes, please.
I'm Tulapurkar. My wife has mental illness problem, but she is not aware of it. I am also having mental illness, but I am taking medicines. She is not taking medicines. Sometimes she gets violent on small things. What?
If she is not aware that she has illness, she is definitely not going to take the medicine. But can you just cajole her to say it is like, I know you have to do some white lies sometimes. It's a multivitamin. Can you take multivitamin to feel strong? Can you say that?
Multivitamin means what? I didn't understand.
How old is your wife, sir?
67 years, 70 years, and I am
70. Yeah, she is my age. Yes. Yes, definitely at our age when the bones are going to get thin, and aging process, the nutritional aspect of it, doctors recommend multivitamin tablets.
I see.
So it's like calcium or iron or whatever it is. So can you cajole her and say that for your better physical health, can you take this is what I'm saying. Thank you from Mugda.
From Dr. Saras.
Ma'am, I have a question. Just like Ganesh sir said that we have to disclose when there is a level of comfort. But my question is that when they will hear the word schizophrenia, won't they freak out?
This is where, how do you tell it? So
Okay.
definitely schizophrenia is a big word for people to be puzzled and intrigued about. So we can start off saying that, I do have some disturbances that I'm taking treatment for.
Okay.
So casually you introduce that concept of illness to them. It is under control. I am on medication on a regular consultation with the doctor.
That name itself is very scary. That's why I was wondering whether I should tell the name or not.
You can eventually, as both of you get comfortable with each other, Mugda.
Okay.
Because see, each one, I said no, each individual is unique by themselves. So some people might take, I have one client who says that, I'm going to be with my partner, it's a he says I'm going to be with her. She developed this illness after she got married, and that is the truth. She was okay before marriage, but after marriage she developed OCD. He said, if she developed cancer or diabetes, would I leave her? No, I won't. I will take care of her. Similarly, I will take care of her. So there are a lot of couples who are that way also, understanding about the illness and saying, if it is physical, I'll be there. Psychological, why should I run away? I will be there with her.
Right.
And the more is going to happen when we talk about it.
Right.
And
Right.
normalize it.
Correct. Thank you, ma'am.
Thank you.
Thank you.
Well, thank you for that, Sarasji, and the people who participated in this discussion. We had a look at a range of questions, the 5 5 Ws, and the 1 H on what to tell or not to tell. And I think one message came out clear is trust, 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 communicate, communicate, communicate. So with that, Ekalavya Foundation and thanks Marijuana Health Initiative as well as its volunteers, and invites you all to visit our website. You would have seen our website URL on the chat. Please visit it and take it from there. Once again, thank you, Sarasji. Thank you, Dr. Saras, and hope to meet you again with some other topic which we can probably lay before all of us and take it from there to the next level of understanding, to a level of well-being, to a level of security and sensibility. Thank you so much.
You're
all.
welcome. Namaste.
Thank you.
Thank you, ma'am.
Have a nice
Thank
evening.
you.
Bye.
Thank you, ma'am.
Thank you.
If
Thank you,
if
ma'am.
you
Thank you, ma'am. Thank you very much.
Thank you.